Good evening, everyone. It is now 7:10. We gave a little bit of ample time for everyone to join us, that those that wish, that have registered to be on our benefit seminar tonight. Thank you, everyone, for joining us tonight. I am the Mid-Atlantic Regional Rep, and our Regional Manager, Kathy Tolliver, will be joining us shortly. Tonight, we are honored to have our Benefits Retirement Seminar presented to us by Mr. Richard Brenner. He is the Government Benefits Specialist, and Mr. Daniel Markham. He is the National Director of Training. Tonight, they will be briefing us on government employee benefits, and they will be sharing some great insight on retirement, pension, FERS, SERS, deferred retirement, and other good governmental information. So please join me in welcoming Mr. Richard Brenner and Daniel Markham as they present to us the Benefits Retirement Seminar on tonight. Thank you so much.
Thank you, Cynthia. All right, like you said, my name is Daniel, and then Richard is there as well. I'm the National Director of Training. Richard and I do retirement seminars for agencies across the country. The goal of this course today is to give you a better understanding of your benefits and how those benefits apply to retirement. Richard and I work in a team approach in which I will basically manage the course today, manage the briefing today, give you information, but we'll only be able to take a high-level approach to that because many of us have a different hire date, different retirement date, different retirement plan, different number of children, different mortgage, different things you want to do in retirement. And all these retirement decisions you will make and career decisions you'll make are very personalized. And that's where Richard's responsibility in this teamwork approach is. He's in charge of making sure that everybody gets an opportunity to sit down and get a free benefit analysis. Now, Richard, I know normally we introduce you a little bit later, but I'll introduce you in the beginning just because we only have an hour and a half together. Richard, would you mind talking a little bit about what they need to have in order to have that benefits report and what that entails?
Yeah, good evening, and thanks for participating. Yes, what we do is we take a approach where a lot of things that you're not aware of or may not be aware of regarding your pension, your supplemental Social Security, annuity pension, sick leave, annual leave, TSP, life insurance, health insurance, Medicare, all those factors play into your report. So what we do is we'll send out information like I did with Cynthia, what I need to create a report. I'm thinking about retiring next year. I'm thinking about retiring in 2 years from now. I'm thinking about retiring in 5 years from now. So we would need information that I will send on an email, but nothing's personal. It's what's your date of birth, when would you like to retire? If you're married, what's your husband's date of birth? What's your annual leave, sick leave, approximate high 3, approximate value in your TSP? If you have any outside life insurance or investments for IRAs, your TSP, and then all that information goes in the report so you can see what happens in retirement. So one of the things I was going to talk about later, I'll talk about now. I have people that I've met in this type environment, and they said, well, financially, I think I need to retire when I'm 65 or 67. I'm not sure. I'd really like to retire, but financially, I think my goals are when I'm 65. I sat down with them, their husband and the wife, who was the one I met, then their husband sat down and we went over everything and compared to what they had been making in retirement, what they thought they needed and what they were making while they were working. And the analysis proved that they could actually retire instead of being 65 and retire. They actually retired last year at age 58. So they what you think you need and what you actually need after the analysis, because nobody does an analysis and nobody looks at it. You looked at it when you got hired, and then down the road, you wait until you're ready to retire, and that's when you assess it. But if I could retire and make more money in retirement than I'm working, would I continue to work? Well, without this analysis, people will continue to work because they don't know they could be actually impossibly, and it's happened many times, be in a better position being retired than you are working. And everybody works because they want to enjoy their retirement. Everybody saves for retirement so they can enjoy retirement. If you like your job, that's great. I hate my job. I love my job. I'll work until I die. I want to get out yesterday, and everywhere in between, and everybody's somewhere in between those two parameters. But if you have an analysis and you could look at your personal situation and evaluate it with your family members, your spouses, whoever your confidants are, when you look at it and you can make a decision, now you can put into focus when's the best time to retire. And that's what this is all about.
All right. Thank you, Richard.
You're welcome.
Now, one big topic of the day and a big question of the day has to do with DOGE, right? With the Department of Government Efficiency trimming workforces and the budget that the House and Senate are currently working on. One of the biggest fears recently was that the bill that the U.S. House of Representatives was working on was possibly going to charge federal employees more to be part of their retirement system. Also, it was going to eliminate the special retirement supplement, the pension before the age of 62 supplement that OPM gives when you were too young for Social Security. Well, it turns out as that bill got passed through Congress, it was deleted. Right now, the big, beautiful bill does not touch in any way, shape, or form any of the federal employees' benefits. But what DOGE has done, and what that big, beautiful bill has done, has asked every department to trim 10 to 20% of their budget because the national debt is so large. So when it comes to DOGE, there's a couple things that we're going to see over the next 6 months, the next year or two, that might be beneficial to understand how they work. Well, DOGE currently is working under the voluntary status or involuntary separation modes. All right. Now, when it comes to USAID, when it comes to Medicare offices, these are the largest groups of people that are subject to the involuntary method. And this is the one that scares most of us. If the agency reduces the budget by 10 to 20%, is there a possibility that my job is eliminated under the involuntary mode? This could be called things like RIF, right? Or reduction in force. Involuntary modes can also provide a severance package. Now, you can't get both. You either get RIF with a pension or you get RIF with severance. The severance package is based on your years of service. The more years you have, the more weeks of pay they're going to give you. If you are RIFed and you have 50 with 20 or any age with 25 years of service under a RIF, you will be able to collect a pension without penalty. You can't get severance and this pension, but it does mean if the agency cuts you with the years of service, you're already locked into a pension and they don't reduce you for age in any way, shape, or form. So you can get a pension earlier, even if they involuntarily remove the position that you work at. That's a big fear for a lot of people, is what happens if I'm involuntarily separated. Now, the voluntary method, that is where most of what DOGE is working towards, where most people are being separated through, is through things like the DRP or through VERA and VSIPs. DRP was an opportunity for you to not get cash up front to walk away in 2025, but to get biweekly pay from now through September, or with exception through December, to collect under a voluntary retirement. Now, DRP means the standard retirement rules. That's MRA with 30, 60 with 20, or 62 with 5. Whereas VERA or VSIP offers 50 with 20 or any age with 25 years of service. And sometimes they will offer an incentive. Sometimes they comboed these when the agencies offered them, meaning they allowed you to go at 50 with 20 or any age of 25 and get that pay up until that point. But each agency was specific on what they offered in these early retirement options. Now, as we go through the course, you're welcome to ask questions. on Doge, Vera, and Visa. If there are any questions out there on what we've covered so far on the two voluntary versus involuntary methods of Doge right now. All right, I saw, let's see, was there a chat that came up, Richard? Or a hand? Tamara, did you have a question? Go ahead.
Nothing in the chat, Dan.
Yeah, she just raised her hand, so I was curious if she wanted to say something. All right, so a lot of questions and concerns can come up concerning this. Richard can run a benefits report for you via the involuntary or voluntary method. In order to get a benefits report, all you have to do is go to our website, the same website you registered on. Instead, click register, click free benefit analysis, and I'll put that link in the chat. This will allow you to click on a link to sign up for a one-on-one with Richard Brenner after the class today. So that link is in your chat there.
Hi,
You should
I'm
also
sorry.
in your
Hello.
go
Hello.
ahead.
Okay,
Go ahead,
it's
Tamara.
Tamara. I
Yes.
finally figured out how to unmute. I'm so sorry.
Okay, that's fine.
Okay, the slide that you had where you wrote out the involuntary. So
Yes.
am I to understand that for involuntary, if you get dismissed involuntarily, but you do not qualify for the two conditions under RIF, that will automatically be severance?
That's right. You
Aha.
have an automatic severance package, and it's 1 week per year up to 10 years, and then 2 weeks a year after 10 years of service.
Year. Up to 10 years.
Mm-hmm.
So
Okay.
if you had 15 years, you would have 20 weeks of severance.
If you had, say that one more time.
If you had 15 years of service, you would get 20 weeks of severance, 1 for 1 for the first 10, and then 2 for 1 for each year thereafter. So 5 times 2 is 10, plus 10 would be 20 weeks.
Gotcha. Okay. All right. Thank you. That's very helpful. Thank you.
You're
Good
welcome.
question, Tamara. Thank you. All right. So links in the chat to sign up for that one-on-one. You should also have a copy of the Federal Benefits Manual inside your email. This is a manual that I'm going to use on the screen. I'll point you to the direct pages and information in there. If you need to reach out to Richard after today, his cell phone number and email address are listed on page 3 of that email. We also include the phone number for OPM. That's because no matter what agency you work for, your retirements are handed off to OPM. We include their mailing address as well, just in case you have to turn in forms. We have the Thrift Savings Plan phone number in there as well. The Thrift Savings Plan phone number is an easy number to memorize, and that's 1 TSP U first. No INT, no team, no I in first. That's how I remember. So 1 TSP YOU F or ST. You can also go to tsp.gov. We'll use that website a little bit later today when we talk about the TSP, but that phone number is listed there. Now, the TSP generally picks up the phone in under 10 to 15 minutes. The Social Security Administration, you'd be lucky to get them on the phone in under 2 hours. So when it comes to TSP, it's a nice phone number to have, but Social Security can be a lot more difficult. If you want access to your instant Social Security statements, ssa.gov. You can do a My Account login directly for that. We also include the phone number for life insurance, the main phone number being Washington, D.C., and a death claim phone number being separate from that. Why? Well, because when you die, your family does not get a check from the Department of Treasury. The life insurance that we pay for every biweekly, those premiums are handed off to MetLife. So when we die, our family has to send a death certificate to MetLife to get that paid out. We also have health benefits, long-term care, and news and resources available to you. All right. Throughout this manual, I'll point to the different pages inside the manual. You're welcome to keep or print these out. We just ask that you do not mass email them out. If somebody wants a copy of this email, they can reach out to Richard directly, but we do ask that you don't email blast this to a bunch of coworkers. Just one or two people you'd like to share it with, that's fine, but this is copyrighted material as part of our course today. Okay? FedSeminar.com, free benefit analysis is how you get that. The manual's there for you. Inside the federal government, there are 2 retirement systems. There's CSRS system and the FERS retirement system. Tamara, just so you know, you still have your hand raised. I don't know if you meant to do that. When it comes to the two systems, the FERS system was introduced in 1984. They decided that all federal
Daniel?
employees would start contributing to the Social Security black hole. Yes, go ahead.
I'm sorry, this is Marcia DeVille. I think that's my hand that's raised. I had a quick question.
Go
For
ahead,
the
Marcia.
RIF with the involuntary separation, and you would get your, I guess, severance. It was my understanding that I know there's an algorithm and a calculation based off of your years of service, but it maxes out at 52 weeks. Is that correct?
So it maxes out at, yeah, any one person can get a maximum of 52 weeks of severance pay.
Mm-hmm.
But in order to get to 52 weeks of severance pay, you'd have to have, let me think, 10 years gets you 10. Then we got to get another 40 weeks. So you'd have to have 30 years of service to qualify for even 50 weeks. You need 31 years of service to qualify. At that point, you'd probably qualify for a pension because you got hired at 18. You'd already be 48 and you'd be any age over 25. So it'd almost be impossible to get that 52 weeks of severance and not the pension. Does that make sense?
Yes, but
So it's a
because-
lifetime 52 is what it is. So let's say you
Gotcha.
get severed from one job and another job, the lifetime severance then would become 52 weeks.
Okay, because I was looking at our, and I don't want to hold up too much time, but we have our, like, I guess through our GRB, like, there are different calculators for RIFs.
Yeah.
For example, for myself, I have 21 years of service. And it was showing a little shy of 52 weeks. And I thought that was kind of strange. But I don't know. And I'm nowhere near 50.
Yeah, the 30 years to get there. Yeah, it's very interesting.
Okay.
Yeah. If you give
Well,
that
thank
to
you.
Richard, he and I can see what it's showing. Sometimes it can be confusing what they put out. A lot of legalese goes into what they produce and hand out to people. Like they never just send you one document. They'll send you like a 9-page document, with a bunch of legalese on it. So we can decipher that when you.
I did have one more question, and I'll let you proceed.
Okay, go ahead.
With the RIF, I know that there are different preferences. Like for military, if you have disability 30% or higher, or different categories, does that impact your severance pay? Because I do have military background. That's why I was wondering if maybe that impacted it at some point.
It could be. It could be your military years adding extra years to that severance package. That's a possibility for sure.
Okay.
Did you buy back your military time?
I
or
did
you
not.
Have okay.
No, I did not.
Do you have a military pension?
I do not, but I have I'm 30% or higher disabled veteran.
Okay. But you should definitely talk to me about buying back your military time. There's a calculation for that, and you should look at that. But that's how they're calculating your severance, I'm sure.
Okay, great. Thank you so much.
You're welcome.
Mhm.
Oh, one thing about the GRB, we found over and over and over, there's always errors in that. So it's not always correct. Go ahead, Dan.
No problem. So the FERS system changed a couple things. It raised the retirement age from 55 to 57, and it lowered the pension calculation from 2% down to 1%. Both CSRS and FERS provide a lifetime annuity benefit or a pension, and if you choose, you can have it last for 2 lifetimes, you and your spouse or survivor. We have ways to add to our retirements and benefits that are available to us, including our thrift savings plan, life insurance, health and care, Medicare, and taxes, and we'll talk about those later today. That lifetime annuity benefit, that pension-based benefit, is calculated based on a percentage of your high 3. Like I said, the CSRS lowered it from 2% to 1% per year. So if I retire with 25 years of service, I'm going to get 25% of my high 3 for the rest of my life. High 3 is an average of our 3 highest salaries. For most of us, that's the last 3 years in which we work. In order to be part of that system, we pay 7% to be part of that system. 0.8% goes into FERS, 6.2% goes into Social Security. Unless you're hired after 2014, you might be paying more than this 0.8%. FERS pension all by itself would be very difficult to live on because if I work for 25 years, I'm only going to get 25% of my high 3 in my math. But if I added my TSP and Social Security, I can get to a comfortable retirement. Now, to qualify for a pension, you need at least 5 years of civilian service. And you must reach your MRA, with the exception of the RIF, VERAs, and VSIPs we talked about, which lower those minimum retirement age. And these things are going to come to pass as these budgets get passed, and as possibly they're reducing the number of employees they have. There's the possibility that you might, I apologize, somebody just registered to join the course, so I'm sending that over to you. Richard, do you mind emailing them a link to the class? Thank you. When it comes to the minimum retirement age, that might be lowered by RIF or VERA. Now, what is the minimum retirement age? Well, this is on your screens and inside your books. Okay. On page 11, you will find the minimum retirement age. Now, this is the earliest age we can voluntarily retire. That's the right-hand side, unless a VERA or VSIP is offered. We can retire at a certain number of years of service at that MRA, which include MRA with 30, 60 with 20, or 62 with 5. And these are immediate, no reduction pensions. Earlier reduced retirements are not talking about RIF and VERA. We're talking about voluntary early, is as long as you reach your MRA on page 11 of your books and have 10 years of service, you can get a pension at that age. But because you don't have the 30 years, you might be subject to a reduction. This reduction is 5% for every year under the age of 62. Involuntary retirements, just like we talked about, lower the age to 50 with 20 or any age of 25. You'll find the early retirements, deferred retirements, and other special retirements on page 12 of the manual. Early outs can be called all kinds of different things, especially as DOGE and many other acronyms are being added to the federal system. There's reduction in force, discontinued service, downsizing, reorganization, transfer of function, whatever the flavor of the week is at HR. Eligible for a reduced annuity when you reach your MRA and complete at least 10 years of service, 5 of which being civilian. That's because, like Richard said, you can buy back your military time. And the reduction of 5/12 1% for every month under the age of 62. So they prorate that 5% penalty by month under the age of 62 when you go out. To avoid this, you retire at the full ages of MRA with 30, 60 with 20, or 62 with 5, or possibly the RIF, VERA, and VSIPs at younger ages. What counts towards my 30 years? What counts towards my 20 years? What counts towards my 5? Well, times where contributions were made. If it says FERS on the pay stub, that time will count. Leave without pay up to 6 months in the calendar year, workers' compensation, all count. Prorated time for your part-time service. And if you buy back your military time, you can add that to your federal career. In the computation of annuity, they take your length of service, multiply it by your high 3, and then multiply it by the 1% per year of service under FERS. With the credible civilian service, they include your civilian service, your military service that you made deposit for, and unused sick leave. As of 2014, you now receive 100% conversion of your sick leave credit. Prior to 2014, all FERS employees caught the FERS flu, and they got sick every single Friday for 2.5 years until all their sick leave was gone. Because prior to 2014, if you didn't give me 100% conversion, I was going to use my sick time. If you turn to your manuals on page 8, you will find the sick leave conversion chart. Now, the sick leave conversion chart says if I have 1,044 hours and convert that, it'll give me 6 months and 0 days worth of credit added to my time. When you add up all your time together, you'll get years, months, and days plus years, months, and days, civilian service, military service if you made deposit, and sick leave, and they add up like this: 31 years, 9 months, and 6 days. There's a potential to have extra days here. I generally say if you have less than 10 days, don't worry about it. But you might have an odd number of years, months, and days because you might not retire on the day you get hired, and you get to choose your retirement date. Now, if I was to choose today, June 3rd, as my retirement date, our retirements are not effective until the first day of the month following our retirement. That means my retirement's not effective until July 1. Think back to when you first got hired. Did they pay you before your 2 weeks worth of work or after your 2 weeks worth of work? They pay us in arrears, right? As a retiree, you have one responsibility to collect a pension check every single month, and that is that you are alive. You have one responsibility as a retiree, and that is to breathe. And if you survive an entire month, you will get your first pension check after you are alive for an entire month and collect the pension on August 1st. How much time goes by between June 3rd and August 1st? You'll see almost 2 entire months pass between your last working day, if you retired today, versus retiring in another day of the month. So what most federal employees will do is not retire on the middle of the month, but they will retire on the last day of the month. That's because the very next day is a new month and they get credit for that month being retired. And now they will collect a pension 1 month plus 1 day after they retire. This means that with this time, they also will get an extra couple weeks of pay, get a couple more bi-weeklies because they work until the end of the month. Some federal employees will take this one step further. They want to retire on the last day of the last month of the year. Why does everybody seem to retire on December 31st? Well, if I retire December 31st, the effective date for my retirement is January 1. What is the first pension check going to come? Well, that would be February 1. You still get the 1 month plus 1 day timeline in which we are getting our pension check very quickly. But the main reason why people will choose this December 31st retirement is because of annual leave. Annual leave has use it or lose it rules, right? We can carry only 240 hours from 1 year to the next. Can I have more than 240 right now in June? 6 months in the year. Can I have more than 240? Yes, you can. Because you could have carried 240 hours from the prior year of 2024 into 2025. Plus, you've accrued more time here in 2025, which now you can have another 208 hours. Annual leave cashes out 2 to 6 weeks after you retire. So if I separate December 31st, I could carry or stack a prior year's leave on top of my current year leave and walk away with 440 hours of annual leave cashed out 2 to 6 weeks after I retire. All right. So what is the best date to retire? Well, in my opinion, the best date to retire was yesterday. Why? Well, we didn't have to be at work today, but not all of us can retire immediately. We have to get to eligibility. We have to get to our time of service. Now, choosing your retirement date, a lot of people choose December 31st because they can stack a prior year's on top of a current year. But the problem with this is you must not do something the last year in which you're working. And that is what? You must not take any vacation in the last year in which you work. And so, as a federal employee, talk about going postal, right? But if I take a week off, I can still cash out 400 hours worth of time. Any questions about best date to retire before we move on?
Yes, I have a question. Oh, you loaded.
Oh, go ahead.
Um,
Go ahead.
yeah, okay. I pretty much followed everything except the sick leave because I feel like that's new. Uh,
Okay.
I always was told that you do not get paid out sick leave. So either I'm not understanding the sick leave part, or what is civilian service? That is federal. Is that federal service?
So civilian service is your job where you work right now, right? Civilian
Okay.
service for the federal government, as opposed to
Okay.
military service for the federal government. So you're going to
Got
work for 27 years, months, and days. Unused sick leave, based on that chart we looked at, I can get months and days added, which in this case, it added 6 months and 4 days. So it added 6 months to what? The total service when they calculate the pension.
So
They
you
don't
do.
cash it out, but they can count it inside your retirement.
Oh, I see what you're saying. Okay. Okay. Gotcha. Thank you. Thank you.
No problem. Now, annual leave is different, right? Annual leave cashes out. Sick leave converts, annual leave cashes out.
Sick leave converts, annual leave cash. That was good. That was good. The way you put that. Okay, that's good. Sick leave.
All right. Any other questions out there? We don't have a lot of time to talk about military service, but like Richard said, it's very beneficial to buy back your military time if you have less than 20 years of service. It'll cost you 3% of your military base pay, but mathematically, it always makes sense to buy back that time. In the high three, they include your base pay plus locality pay in that high three, but it does not include any bonuses, overtime pay, military pay, or cash awards. The high three gives you night differential and environmental differential, but only if you're wage grade. If you're GS base paid or salary, they don't pay these extras. In the computation of our annuity, we get 1% per year of service. Unless you retire after the age of 62 with 20 or more years of service, they'll give you not 1%, but a 10% increase to 1.1% for the years of service. In our calculation, we're planning on 3 incomes in retirement. You have your FERS, you have your Social Security, too many S's, and we have the TSP. FERS we can access at our MRA with 30 years, 60 with 20 years, or 62 with 5. You may know that you can't access Social Security until 62, and that is a 25 to 30% reduction because I'm turning it on early. We can wait till 70 to turn it on to get 100% of the calculation. Whoop, sorry, not 70. We can wait till 66 to 67 to get 100% of the calculation. Or we can delay to 70 to get 130% of the calculation. We can access the TSP without penalty at 59.5 or separate in the year in which you turn 55 or older. You could access the TSP without penalty. There are 2 standard voluntary retirements that are too young to qualify for Social Security. So what do? They have something called the Special Retirement Supplement paid by OPM in addition to your pension to get you from retirement to the age of 62. This supplement is subject to the earnings test, just like Social Security. They calculate it just like Social Security. Who's eligible for it? Well, that's with those with the MRA with 30 or 60 with 20. Anybody who retires after the age of 62 is already at Social Security age and would not be able to collect the supplement. For those of you that are going through RIF, meaning you're leaving before your MRA, you would get your supplement when you reach your MRA. So let's say I separate at 50 years old with 20 years of service, either voluntarily or involuntarily. I wouldn't get that supplement, but the day I turned 56 or 57, my full retirement age, I could then start collecting the supplement until 62. So you could get that supplement as well. How do they calculate the supplement? They based it on a 40-year career. That means the government expects you to work for 40 years for them, but most people don't work that many. If I had 20 years of service upon separation, I get 20 divided by 40, or 1/2 of my Social Security early. Whereas if I had 30 years of service, I'd get 3/4 of my Social Security early through the supplemental income. So that means now I have that 3-part retirement system. Each one of these will pay out when I plan to retire. Hopefully, I have the correct years of service to avoid reductions or penalties when I get there. Now, the earnings test says that if you collect Social Security, which is a welfare system, there are certain people who are collecting Social Security right now. Who is paying that bill? That's us, right? We're the ones working, paying into Social Security for our parents and grandparents who are drawing off Social Security. When we get to Social Security age, who's going to pay our bill? Well, that's the generation after us. So if you were disabled or too old to work, Social Security could kick in. But it says if you make more than $23,400 While collecting your Social Security, you will get $1 for every $2 you earn over this limit. So I can go get a part-time job. I can go get a full-time job as long as it's not paying me more than $23,000. This earnings test goes away when you reach your full Social Security age, which for most people in this room is 66 and a half years old or 67. You'll find this on page 35 of your manual. In 1988, they changed the Social Security system and moved the retirement age from 65 to 67. If you're born after 1960, you can earn as much as you want after the age of 67. But prior to that, because you're under early retirement rules, and if you're receiving the supplement, they cap you at that $23,000. And every dollar you earn over that, they knock out 50 cents. When it comes to Social Security, the biggest question, and we often get with Social Security, is should I take Social Security at 62, or should I wait till my full retirement age to collect it? Now, you may be able to live on your TSP, other income, or something, another job between the ages of 62 and 66 and a half, and say, you know what? I don't want to take on the penalty because I can get $500 more if I wait to turn it on. Now, that's a lot of money. So most people would say, you know what? I want to wait and get that extra $6,000 a year, so I'm not going to turn it on. But in order for me to get that extra $500 a month, a couple things need to happen. First of all, you have to say no thank you to the $1,500. How many times did you say no thank you? Well, that $1,500 is represented in monthly payments, right? So I get 12 of those a year. And I'm going to wait 4.5 years. This turns out you will have turned down $81,000 in order to get an extra $500 per month. If we divide the 81,000 by the $500, that'll still tell us how many months it takes us to catch up, right? Because we said no thank you to 81,000. Richard, I'm sending you another person who doesn't have the link. Could you go ahead and send that?
Yes, sir. Thank you.
Thank you. This would take 162 months. Which turns out to be 13 and a half years. 13 and a half years plus the age of 66 and a half when I get the extra $500 a month means I will break even at what age? Average life expectancy is what today? Well, it turns out average life expectancy today is age 80. So if you're telling me it's going to pay out the same no matter what, living to age 80, why would I wait to turn it on? At what age would I start to get the extra $500 a month? Well, it's 80 years old and 1 month. And at 80 years old and 1 month, what is the extra Social Security of $500 a month going to when I'm 80 years old? Well, maybe it's going to new tennis balls on the walker, new rims on the scooter, something completely different than it was going to at younger ages. For most of us, turning on Social Security early would make sense because mathematically, it doesn't break even till the age of 80. Any questions about Social Security before we move on? Lori, it is not the book as the best. Oh, Richard, you responded to a question there. Okay, you answered a question.
Yes.
Okay. Sick leave, best age to retire is not in the book. No, that's a mathematical calculation that we need to figure out. More of a one-on-one basis.
I do have a quick question about Social Security. These numbers that are on your slide, the
Uh-huh.
23 23,000. Not that slide. That's a very
Oh,
good
not
slide,
that.
but not that slide. The
Earnings test.
Yeah, got it.
yeah. What are these? How did they come up with these numbers? These numbers seem very arbitrary. 23,400,
If you multiply,
62,160. This is stupid. Is this being
yeah, well,
recorded?
if you take 23,000 divided by 52 weeks, okay, so 23,400 divided by 52 weeks, it's basically $450 a month. Divide that by 40 hours a week, it's $11.25 an hour.
Oh,
So that is basically where it comes from. It's a lower end income is what they're basing it on. If you work full time making $10 or $15 an hour, you're going to break the earnings test. So it just means going to work is going to be an issue. Now, if you work 1 day a week, you're probably not going to go over this limit. But if you go find a full-time job, you're going to have to wait to turn it on because of the earnings test. This is scaled by cost of living since the day they put it in. So it was like 12,000 or 15,000, like $1,000 a month was your maximum. But as time goes on, COLAs increase this number. Last year was 22,600. This year is 23,400.
That's very helpful. Thank you.
No problem. Good questions. So when it comes to Social Security, a lot of people would turn on Social Security early just because of this math right here. But this is an individual choice you're going to make. My mother, I showed her this numbers, and she retired last month, but she's not turning it on until 67. There's nothing I can do to show her it makes sense to wait. That's fine. It's all an individual choice on what you want to do. But I'm just showing you the mathematical numbers so that you can make a choice. Tamara, I'm just going to lower your hand, okay?
Yeah, thanks. I'm sorry about that. I keep forgetting.
It's okay. It just shows up as a notification until it goes down for me. So I just want to hide it so that I know when somebody else is in there. And thank you. When it comes to our Social Security, there is a survivor benefit built into Social Security. That means if I die, my Social Security will be the higher of the two between you and your spouse. So if I'm getting $2,000 a month, my spouse is getting $1,000 a month, I die, her $1,000 will go up to $2,000. But while we were both alive, we got $3,000 between the two of us. When it comes to survivor benefits with the pension, at retirement, the former spouse with a court order would take precedence for your pension. We're now switching to pension survivor benefit. Or if you choose, you can pass it on for your spouse's lifetime. If married at retirement, the former spouse with the divorce decree will take precedent. You can leave behind a full benefit or a reduced benefit, or you can have the combination of your current spouse and former spouse with the signed form from your current spouse agreeing to that. Now, inside your books on page 33, you will find the three choices we have as a FERS employee. We can leave behind 50%, we can leave behind 25%, or we can leave behind 0% of our pension. Social Security is automatic higher of the two. On your retirement application, you'll make this choice. If I leave behind 50%, it'll cost you 10% of your pension for as long as you both shall live. Choosing the lower cost option, well, it's a 5% cost. $0 option, that is a $0 cost. You won't make this decision until your application for retirement, and this is a permanent decision. And there are no refunds. Why would I want a refund? Well, if your spouse predeceases you, you no longer have to pay the 10% cost, but they won't refund the years prior. So with survivor benefits, this is a choice that you make on your retirement application. If your spouse relies on health insurance, you may have to choose something other than the 0% cost, because if the pension goes away, so does the health care. So if your spouse needs his health care or a dollar amount beyond you, you're going to have to sign up for it. With the survivor benefits, if I had a $2,000 a month pension, it cost me what? $200 a month to provide it. And then my spouse would get 50% of the $2,000 beyond me. If I had $2,000 a month and picked the 25% choice, only cost me 5% or $100. My spouse would then get 25% of the $2,000. And if you were supposed to get the supplement or receiving the supplement, your spouse could also receive it. The survivor benefits will stop if the spouse or former spouse dies or remarries before the age of 55. If married to a federal employee for 30 or more years service, they can remarry before 55 with no loss of survivor benefit. So they can get that 50, 25, or nothing. Now, insurable interest is somebody other than your spouse you're providing the benefit to. There could be a higher cost associated with that. In the survivor benefits with the insurable interest, we got the reduction for the former spouse and the reduction for the current spouse. There's room on the application for one current spouse and up to 2 former spouses, but more modern divorces tend to be both working employees or both working spouses, and they both go their separate ways with their incomes. There are benefits that are paid extra if you die during your employment, but I'm very quickly going to go through these. And the reason is it's not part of our plan to die before retirement. Okay? It's meant that we're getting to retirement. We live many years into retirement, making the plan based on that. If we die and we have at least 18 months of service and you've been married for at least 9 months or more, your spouse can receive $31,000 plus 50% of pay upon death.
Interesting about that, Dan, is that it becomes taxable. That's taxable, like an IRA.
You have the opportunity to actually roll this over into an IRA and avoid that taxable.
Correct.
You can directly roll it over to avoid that taxable event for your family. Now, your spouse or family member is going to have to make that choice on the application. You have to do it right then and there and move it directly to an IRA. Otherwise, it becomes a taxable event. Plus the special retirement supplement, if you were supposed to get it or are already receiving it. For those of us who are special provision, law enforcement, firefighters, air traffic controllers, you get the benefits as long as you live to the age of eligibility in the special provision rules. Now, the normal order precedence is something we want to pay attention to because pretty much all of our benefits pay out this way. That means when we die, if we have a beneficiary form on file, that comes first. If we don't have a form on file, it will go to our spouse. If we're not married, it goes to our child or children in equal shares. If we're not married and have no kids, it will go to our parents before it goes to the will. And lastly, it'll go to probate court. Changes to CPI or the Consumer Price Index every single year will increase our pension. As our pension goes up, so does the cost of our survivor benefit. It will not start until the age of 62. So we'll have a flat level pension until that time. But it's nice to know we'll have a cost of living adjustment given to us by OPM. So as the cost of life goes up, as taxes go up and insurance goes up, so can our pension hopefully help us keep up with that. Our health benefits plan is available, and you can take that in retirement with you. You have a free choice among health benefits plans. There are 3 types of enrollment, which include self-only and self and family. The third category is self plus one. That is you and your plus one. It could be a single parent or 2 married federal employees who then have their children who have aged out. Changes to FEHB can be done during open seasons or life events, which include marriage, legal separation, death of a spouse or dependent, or loss of coverage by your child aging out. FEHB can be kept as retirement, has the same cost as current employees, and you must be eligible for retirement. So it will go up 5% for the workers. It goes up 5% for the retirees. If we would like to keep along, we are moving on from health benefits to Medicare, which begins on page 40 of your manual. Now, Medicare is a very complex system. I will do my best to simplify it for you. And of course, each person here might want to use the opportunity in which you sit down with Richard Brenner to put your plan together for Medicare because you may or may not sign up for it at 65. Medicare is simply health insurance for those of us who are 65 and older. There's a Part A, Part B, Part C, and a Part D. Part A, that is ER and hospital room coverage. Part B, that's inpatient, outpatient care. This is doctor visits, follow-up surgeries, and those kind of things. Part C is a supplemental, and Part D is a drug plan, and not the Colorado kind. Everybody here at the 65, working or not working, should enroll in Part A because it's free. It's not really free. You've been paid for it your entire career. When you get to 65, it becomes free. Inpatient, outpatient care, the Part B has a current cost of $185 per month per person. That means that if I add Medicare to my health package, I'm going to be paying $185 a month for me or $370 a month for me and my spouse. $370 a month is cheaper than FEHB, but there's a 20% standard deductible when it comes to Medicare. This is why supplements exist, because they take care of that 20% deductible. What do federal employees do? Well, they keep their FEHB. That's because with FEHB, you don't need to sign up for a plan. You can have Part A, Part B, and FEHB and have the no deductible, no copay coverage that most federal employees like. The government will keep paying that 2/3 into retirement, so that FEHB plan is something we generally do not let go. Although Medicare might be cheaper, it's not as good as the health plan we have. Then we have the drug plan. Now, if you have FEHB, if you have a supplement, you will not need the drug plan. Is there anybody in the room that is covered by TRICARE? Do I need to cover TRICARE as well? All right, so we do have somebody covered by TRICARE. So the one additional thing is TRICARE at the age of 65 converts from regular TRICARE to something called TRICARE for life. It is mandatory that you enroll in Part A and in Part B. Otherwise, they are going to kick you out of TRICARE. So federal employees don't have to sign up for Part A and Part B, but TRICARE participants must enroll in Part A and Part B. TRICARE for life is free compared to the annual $600, $650 premium you pay, but now you have to pay $185 per person or $370 per couple. All right. Medicare is one of those complex topics that I always take a pause here to make sure anybody has any questions. And Richard, I don't mind if you chime in and answer Medicare questions here. Does anybody have any questions about Medicare?
There are a couple things that people should know. There's what's called an IRMA, or your Medicare is predicated on your last 2 years worth of income. So if you have Medicare, or you need Medicare, or you want to enroll in Medicare and it's $185 in 2025, it changes every year. But if you make over a certain amount of income, then they're going to charge you more for Medicare. But because you have a life event, because you're retiring, you can apply for a reduction in your Medicare premiums, because some people making $150,000 are going to pay more than the basic amount for Medicare. So there's a form to fill out that will reduce your Medicare cost. Plus, if you have Medicare and you need to have TRICARE, pays $80. Right now you're paying for TRICARE. Maybe you have or don't have the FEHB. If you have TRICARE and you're utilizing TRICARE and you turn 65 and you have to get Medicare, there's plans that you see on TV that will actually give you back money, give you dental and vision. There's some things that you should talk about. You should definitely talk to me because it can save you a lot of money. Medicare doesn't know what you made in 2025. They know what you made in 2023. So if you were retiring this year or next year, they're using 2 years prior income. So you're retired, you're on Medicare, but they're using 2 years ago's income. So you'd want to be able to send a form in to Medicare that shows that my income has changed. You don't need to charge me the premium. It's called IRMA. It's the Earned Medicare Adjustment. So something that you definitely need to talk about, and definitely things that people don't know exist, and would definitely do people a lot of service. I wanted to address something went back to the beneficiaries. When you do beneficiaries, you can change beneficiaries whenever you want. If you don't have beneficiaries and you just left it, oh, I know they're going to do beneficiaries for, you know, if I don't have a designated beneficiary, it's going to go to my spouse, then it's going to go to my children, etc. If I don't name them, then they're not going to give it immediately because they don't know if you have 1 kid or 4 kids. They're going to hold it up for a year, waiting for your kids to make the claims, because if one child claimed it, they would give it all to one child. No, no, no. They're going to wait. So it's really important to update and check your beneficiaries and make sure that they're there, because you want the money to go where they need to go. Especially, a lot of people have life insurance through the government, through the FEGLI, which we'll talk about, but they don't name beneficiaries, or the beneficiaries don't know they even exist. So some things you need to definitely consider and talk about. But the one thing that there was a question, Danny said, do in-laws count when it comes to parents? I don't believe so. I think it's just your immediate family in that order of precedence. That's why
On
you'd
the
want to name
automatic, yeah.
beneficiaries. Yep. I think you'd want to name beneficiaries 100. There's no reason why you would never want to make sure you have beneficiaries. The TSP, when it changed from the old website to the new website, 1 million people lost their beneficiaries. I would definitely check it. There's ways to add to your and update your beneficiaries. And when you retire, there's ways to update your beneficiaries. But it's very important to do it. Had a case where a retiring person filled out the paperwork. The beneficiary was the spouse. She also signed as the witness. It took 1.5 years to untangle that mess, because when a beneficiary signs as a witness, it makes it not a good form. Let's leave it that way. And because they did it, they thought they were doing a shortcut. They were putting themselves in a jackpot, because it took them 1.5 years and multiple phone calls and lawyers involved to get the money. So do yourselves a favor, update your beneficiaries. The stories always is told. The husband's married to the first wife, gets divorced, marries, has kids with the second wife, dies, but he never changed his beneficiaries, and first wife gets everything, second wife with the kids get nothing. Just check your beneficiaries. It's something smart to do. Go ahead.
Thank you, Richard. One other question that came up in the chat that wasn't addressed is, if I'm in my 40s now, will Social Security still be there when I get there? Social Security can't go away. If it went away, Florida would start to sink into the ocean. So would the U.S. economy with it. The only concern is we're going to have to change Social Security, maybe the ages, maybe the amount it pays. It'll still be there long term because it props up our economy. The most promising thing that may occur is a privatization opportunity, in which you may be able to switch to a privatized option and more like a 401k, rather than having the government light it on fire and worry about if it's going to be there when we get older. All right, so we talked about Medicare, we talked about healthcare, right? Let's talk a little bit about life insurance and the TSP, and we'll wrap it up today. When it comes to our life insurance, we have different levels of insurance. There's the basic insurance. And if you have basic, you can add A, B, and C. The basic coverage, this is your salary rounded up plus $2,000. It has a cost of 15 to 16 cents per thousand. Unless you're a postal employee, it is free. You must have basic for A, B, or C to in place. The extra benefit acts just like basic, but it doubles if you die before the age of 35. The doubler goes away by 10% per year until by the age of 45. All you have is your basic, which is that same salary plus $2,000. Now, if you have basic, you can take it in retirement at 3 levels: a no reduction, a 50% reduction, or take on a 75% reduction. 75% reduction is the most popular choice because you don't have to pay premiums after the age of 65. It becomes free. If you'd like to keep half of what you had, it'll take twice as much. If you'd like to keep the same coverage you had, it could cost you 5 times the original cost to provide it. Now that's the basic coverage. If you have basic, you can add option A to your package. This is an additional $10,000 Cancun trip for your spouse when you're gone. You pay premiums till 65. There's no cost after 65, but it goes $2,500 down to $2,500 in protection. which is enough for a Walmart.com casket. There is no way to keep it at 10,000. This is an automatic reduction past the age of 65. Option B insurance, this is 1 through 5 times their salary. The cost of this term insurance gets very, very expensive as you get closer to older ages. They do not want you to die before your normal age because that would actually pay out. Most federal employees will drop this long before it ever pays out. Option C coverage. This is on family insurance. This is up to $12,500 on a child. Now that's a minor child dying before we do. We're up to $25,000 on a spouse. At 65, this also reduces by 2% per month. Now I caution you, don't make any changes, but one page out of the benefits report that Richard's going to run for you will look like this, in which it breaks down the life insurance we've signed up for and how those life insurances are going to go into retirement. This term insurance could potentially cost you more money than it actually pays out. If you look at the far right column, this person will have paid $73,000 in order to leave behind a death benefit of $30,750. But until you sit down and run the benefits report with Richard, I recommend you don't make any major changes for your life insurance. All right. Are there any questions about any of the benefits we've covered? Otherwise, we're going to spend the last 15 to 20 minutes here talking about the TSP. Shibiki, you have your hand raised. Go ahead.
Yes. Quick question as it relates to life benefits. Is it advisable to get additional outside benefits?
Richard, do you want to go ahead and handle that question?
Very, very good question. That in itself is a very good reason why we should have a one-on-one conversation, because yes, it all depends. TSP benefits, what ages of you and your spouse, children, not having children, mortgages. There's a whole lot to the big picture to make the right decision whether or not you should get it. Long-term care, some of these policies that have insurance, most insurances, including the FEGLI through the government, is what's called death benefit insurance. While you're living, you pay. When you die, somebody else gets paid. There's no in between. Some of these policies come up with what's called a hybrid. So if something were to happen and you passed away, it would pay your family a benefit. But what if you got sick? What if you got a terminal illness? What if you had cancer, heart attack, or something like that? You could utilize money from the policy, the face amount of the policy, to pay for what you need. What happens if I needed to go to a nursing home or assisted living or home health care? Let's say you had a $500,000 policy. They would pay you part of that $500,000 every month to take care of what you need. It's there for you if something happens, and if nothing happened, it would still pay your beneficiary, as opposed to a long-term care policy, which nobody ever wants to use. It's expensive, a lot of moving parts. If I never use the long-term care policy, what happens? Money that you spent goes nowhere. On these hybrid policies, if something were to happen and you needed it, it's there for you. But if you never needed it, at least it goes to your beneficiary. It's ways to utilize and look at your benefit reduction in your pension versus spending $300 or $400 or $500 a month for a benefit if I had insurance to pay for that. Because what if I outlive my beneficiary? It's a surviving spouse benefit. So if I'm not my surviving spouse, and I mean, if I outlive my surviving spouse, then I spent all that money in reducing my pension because I love my spouse, but I outlived him, so all that money is a waste. But if I'm putting that money in an insurance policy, at least it would go to someone, myself or somebody else, if I needed it for home health care or assisted living. It's another conversation to have. That's why these one-on-one appointments are really beneficial, because when we talk about it, it's your situation, not in a group setting, and then you can be focused on exactly what you should do, what's the right amount of coverage, what I could do, what I should do, and understanding all your benefits, because when I tell everybody when I was a little kid, I don't know what you guys wanted to be, but I told everybody I wanted to be a federal employee retirement specialist. And here I am. So, anybody that's got any questions, if that answers your question, it's definitely something that should be considered depending on your age, health, and everything. It makes sense or may not make sense, but it's something that should be looked at.
Okay, another question came up, Richard. Does FEHB cover deductible in Part A Medicare?
Does the FEHB cover Part A deductible? Yep. There's no Part A deductible. The Part A deductible is if I needed to go in the hospital, I didn't have FEHB, I didn't have anything but Medicare Part A. It will allow me to walk into a hospital, pay $1,600, and now I have the first 60 days of a room. Every day thereafter is a daily charge. If I have FEHB and it has a limit on my hospital stay, it'll say 1 night hospital stay, 250, 2 nights, 500, up to a certain amount of money. Option B for Medicare pays 80% of the charges that go on in and around the hospital. The other 20% can be paid by you through a health insurance plan that you see that all that stuff in TV in October, November, or you can use the FEHB, and then by paying Medicare and a reduction in your FEHB and keeping a drug plan, now I have no co-pays, no deductibles when I go to the doctor, the hospital, inpatient, outpatient. Medicare pays 80%, FEHB pays 20%. I pay zero out of my pocket.
Following question that also had to do with Medicare. With your Medicare A and B, you keep your federal insurance.
That's
Blue
an
Cross
option.
and Blue Shield will pay you a once a year $800 reimbursement. Yeah, some of the plans will give you a $75 a month reimbursement totaling $800 a year if you sign up for Part A and Part B, because they're a secondary payer, not a primary payer. So certain
Because
plans
now,
will have refunding on it. Go ahead, Richard.
right, because if Medicare pays 80%, Blue Cross Blue Shield is giving you back money because they're no longer on the hook for 100% with you. They're on the hook for 20%. So they're giving you $800 a year incentive to stay with them. There's other options outside the federal government, which you can, and everybody's told you all these years, keep your FEHB. It's the best thing. Never get rid of it. There's things you can do with the FEHB. You can suspend it, try something else, go back to it if you want. There's other options that aren't really talked about, but better options, in my opinion. But it's something that you can consider. You never have to get Medicare Part B. If I never sign up for Medicare Part B, I never have to get it. I can run the FEHB the rest of my life. That's an option. I can keep the FEHB all the time. I can get the FEHB along with Medicare. I can suspend the FEHB. Everybody's situation is different. You want to make sure that your health care is done the best way. If you have the FEHB and Medicare and you go to the doctor, you go to the hospital, you go to inpatient, outpatient surgeries, whatever you do, you pay zero for. So if you're on the beach in Tahiti having a margarita, or you're on $1 million surgery, you're paying the same amount of money to Medicare and the FEHB every month. You're on a budget for your health.
Two questions that related. Is requesting analysis the way to get the one-on-one sit down with you? And how often should we sit down with you to convert or talk about an analysis?
Well, I have people that I've been talking to for the last 10 years, and then every couple of years. So I would say sooner the better to have an analysis, look at it and see what your options are. And then in the future, every couple of years as things change, maybe you need more insurance or less insurance, or now you're becoming 65. Do I have TRICARE? Do I have the FEHB? What do I do? You have open enrollment for Medicare 3 months before the month of and 3 months after your 65th birthday. You can also work through the age of 65 and then retire. And then you have 8 months after you retire to have open enrollment for Medicare. Like I said, you never have to get Medicare Part B if you don't want to. And there's ways around it with this earnings test for Medicare costs. So there's a lot of moving parts with all this. That's why these one-on-ones take typically an hour to an hour and a half. You can do nights or weekends, have your spouse there asking the questions so you don't have to turn around and try to explain all this. We do this seminar typically in 2 days. We're making it more concise. That's why Danny's kind of going over everything. But the idea is these one-on-ones help you to focus on what your situation is. And like I said in the beginning, some of you didn't hear me. I met with people like I'm meeting with you now, and people think I'm going to work until I'm 65 or 67 or 70 because they don't have any idea what their benefits are. And I sat down with people and I've shown them they're financially thinking I can retire at 67. They don't really have a clue that they could have retired 8 or 10 or 12 years earlier. Why are they still working? They can make more money in retirement than working, but they didn't realize that they could and have some guarantees. So by having these one-on-one meetings, you can really laser focus my retirement and know by the time we're done when you want to retire. I mean, if you think you want to retire in 2035 and you can see that sitting down and you could retire in 2026, it's 8 years of retirement for 9 years of retiring sooner than later. Can I, do you assist with evaluating our expected expenses? Yes, I can do that. For the supplement, given my OPM retirement, how is this income allowance calculated if you turn 62 in the middle of the year? For the supplement given by OPM, once you turn 62, the supplement goes away. So Darrell asked about the supplement given by OPM. The last month of your supplemental insurance paid by OPM is 61 and 11 months. That's your last payment. So after 62, that supplement goes away and you can turn on Social Security if you choose to. Long-term care is expensive. There's a lot of moving parts. The FEA, the federal long-term care was done by John Hancock. 2 years ago, how does an insurance company make money? They bring in premiums and they pay out claims, and what's left over is their profit. More people living longer, staying in nursing homes longer. The federal long-term care, John Hancock took it away. You can't even sign up for it if you want because they were losing money. Long-term care has many, many moving parts. Do I wait 90 days or 180 days before it kicks in? Is it only home health care or only assisted living or only nursing home or all three? How much is the daily charge? Well, right now, let's just say it's $9,000 a month. Well, if you're young, you're not going into a nursing home anytime soon. So long-term care, I'd want to have a cost of living adjustment. How big is that cost of living adjustment? 3%, 4%, 5% every year. Is there a maximum amount of days or years in the policy? There's many moving parts. And the worst part about long-term care insurance is if I buy it and I don't use it, it becomes a waste of money. So people don't like to get it. It's expensive. And you're really talking about things when you think about your family and if you were ever exposed like I was to nursing homes, nobody wants to really go to a nursing home. But long-term care is a good place to have money to be able to do what you want. If you go to a nursing home and you go or want to sign up for a nursing home because that's where you want to go in the future and you don't have long-term care, what do? How do you like to pay? I have a pension. Great. What else you got? I got Social Security. Great. What else you got? And they start sucking away your assets. My grandmother was in the nursing home for 3 years, had some money saved. The nursing home took it all. Ended up that my family had to chip in for the funeral because there was no money left. So long-term care is an expensive proposition with many different moving parts. On one-on-ones, I can explain it further and take more time to explain it. But there are those hybrid policies that do give you multiple options for long-term care, critical illness, and chronic illness.
All right. We're going to have to pause on questions till the end at this point because we need to get through the TSP in the next 10 minutes here. When it comes to the TSP, if you'd like to follow along, inside your books, the TSP section follows after Medicare and all of that. I believe on page 58, but let's see right here real quick. No, 59. When it comes to the TSP, we're limited on how much we can contribute. If we're under the age of 50, that's 23,500. If we're over the age of 50, it's 31,000 total. If you're 60, 61, 62, or 63, you get an additional 11,250 you can contribute. There are 5 funds we can invest in. The first of the 5 funds that we're going to define is the G Fund. This is a government security fund that is guaranteed to never lose money. Unless you compare it to inflation, often this falls behind inflation. So the G Fund is our treasury fund. Moving on to the F Fund assets are mirroring the returns of the U.S. aggregate bond index. So the F Fund is bonds. It's also a conservative fund between government securities, asset-backed securities, and credit-backed securities. When it comes to the C Fund mirrors the returns of the S&P 500 index. It's often referred to as C Fund or Common Stock Fund because the top 504 companies or so are listed on the C Fund. Moving on to the S Fund. The S Fund is the Dow Jones TSM Index, which stands for the Total Stock Market Index. This is every company that's not big enough to be part of the S&P 500. And then we have the I Fund, or the International Fund, mirrors the returns of an EAFE index. 4 out of the 5 funds inside the TSP mirror the returns of an index. The easiest index to understand is the common stock, or the S&P 500, or our C Fund, right? There's companies we know like Walmart, Apple, Microsoft, Verizon, AT&T. Big companies we know the names of. Enron used to be listed on there, but they're not stocks worth the paper they're printed on. More recent replacement was a company that I use on a weekly basis, and that is a company called Office Depot. In the retail sector, Office Depot doesn't represent a top 500 company anymore, and it was replaced by a company that been integral to your retirement. Netflix, a very large company, replaced Office Depot. What they do is they take 503, 504, or 505, replace the next highest one. Over the long term, what do the indexes do? You've seen this happen inside the TSP. 4 out of the 5 funds mirror the return in index, just like the S&P 500. It's a list of 500 stocks. If we go to the TSP website, the most common thing that federal employees do is they go right here to log in. But I'm going to stay out of the login, and I want to show you the rates of return history, because you can see not how your return has done, but how these funds have returned. And if you want to see the index side by side on how it returns, you can. So TSP.gov will show us the 5-year and 10-year on each one of these accounts. So it's possible that the C Fund can give you higher than a 10% return. Since inception, in a 10-year, in a 5-year, or even in a 1-year, the C Fund is up 13.47%. You can see historical rates of return for these different funds. Now, they often recommend you diversify. There's an automatic diversification tool called your life cycle funds. This year, next month, July 2025, the L2025 will expire and become part of the life cycle income. That's because when it moves one more step on its chart, which it goes from A to B, July 2025, this is an exact mirror of the life cycle income fund. So 2025 will merge into the life cycle income next month, and they will add a 2075 fund to it. The only caution I have for people is if you do life cycle income funds, it is very heavy in the I fund, or the international fund. We can put money into the TSP. We talked about the limits and caps. We can choose between all these funds, and there is a new mutual fund window in which you can move money into the TSP and out into private sector mutual funds. This has a cost of 50 cents per year. I'm sorry, $150 per year, $28.75 per transaction fee to be part of the mutual fund. It's not very popular because the C Fund and the S Fund give you high risk-based funds. Why would you need mutual funds to do that? Now, we've talked about putting money into the TSP and the funds we can use. Let's talk about withdrawals. There's a list of the withdrawals in your books towards the end of the TSP section on page 83. So our 3 choices for withdrawal include a lump sum withdrawal. Now, why are we going to cross that one out? Not recommending we take large withdrawals from our TSP because it will affect taxes. It'll throw us through the brackets. The next option is what? Well, that is a partial withdrawal. You can take 500, you can take 5,000. Do not use this like an ATM because you'll run out of money before you run out of you. The next one is monthly payments. You can take monthly payments out of the TSP. You tell them how much to take, they'll send it to you. Next one is a MetLife choice. And lastly is rollover to an IRA. Half of people would choose monthly payments. Half of people would choose to roll over to an IRA. Nobody rolls over to MetLife. And the reason nobody rolls over to MetLife is because if you look at TSP annual statement, the largest font that sticks out on the whole page is this 1606 per month. But the 1606 per month has something next to it you need to be scared of, and that is an asterisk because you need to read the fine print. In order for you to get that 1606 per month, you must be 62 years old. You must use an annuity rate of 3.25%, and you must take level payments with no additional features. That means you take all $285,000 of your TSP, you give it to MetLife, and they will pay you $1606 per month. What is MetLife hoping happens shortly after they start paying you the $1606 per month?
You die.
That's right, because you forfeit the principal. Nobody picks this. Half of people choose monthly payments. Half of people would choose to roll over to an IRA because of this. You can leave the money in your traditional all the way until your 72nd or 75th birthday. The RMD age chart is on page 84 of your manual. If you're born after 1960, you can wait till as late as 75 to draw the income. When it comes to planning your retirement, it often makes sense to do a net to net analysis. And a net to net analysis basically takes what your current income now is. If I had a 50,000 employee, they're making about $1,000 a week, $2,000 biweekly, but they don't get to take home $2,000. We know this on our pay stub. We have a gross pay and we have a net pay. If we take that $1,000, multiply it by 26, this is $26,000 in take-home pay that a 50,000 employee makes. If you take your payroll on what you get paid every 2 weeks, that's what you're used to living on. You multiply that by 26. That's the discretionary, that's the income I'm paying my bills on. So our target income in retirement should not be the 50,000, but it should be this 26,000 in retirement. Take that and divide by 12 equal payments. Our new target is our net take-home pay of $2,166 per month. If I serve the federal government for 25 years, I'm going to get 25% of my salary, or $12,500 in my FERS pension. We divide that by 12 equal payments, and we get $1,041 per month. Now, somebody who works at $50,000 a year is going to get about $1,500 a month from Social Security. This employee now is at $2,541 with just 2 incomes in retirement. And you might say, oh, this person can retire and not touch their TSP. There's a problem. This number is net. Pension and Social Security are illustrated in gross. So we really need to take this down by subtracting $500 a month for health care. $400 a month for taxes. And now I'm at $1,641 per month. Now I'm significantly short on this income, right? So now I have to add in my TSP. If I get $4,000 a year from my TSP, divide that by 12 equal payments, that's $333 a month. Uncle Sam's going to take his part. Now I have $273 from my TSP, plus my $1,641. I'm at $1,914 per month. Now, with our 3-part income, we're only shy $252 a month. That means I'll make $252 a month more by what? Working. If I work. And I'm working, I'm going to get $252 a month more. I work 40 hours a week, 160 hours a month. How much am I getting paid an hour? Well, that's $1.57 an hour to continue to work. In order to figure out your net to net, you need to know what you make biweekly, and you need your 3-part retirement. On the software that Richard's going to run for you, one page will break down this 3-part retirement, and you can get down to what is your net to net. Because our goal should not be $50,000. Our goal should be what? Making similar income to what you make right now. Because if I told you can make similar income retired that you're making right now without having to work, would you continue to work? And 95% of us would say no. I'd retire if I could live at the same lifestyle I live now. Because there are certain things you pay for now that you are not going to pay for in retirement. And the net to net analysis is a fantastic part of the one-on-one that I highly encourage all of you to go to the link in the chat to sign up for that. Because now it's going to take this information that we kind of went very quickly through and apply it to you specifically with your hire date, your retirement date, your high 3. Can you clarify? If you're 61 plus, you can make additional contribution to the TSP of $11,500. No, it is only the ages of 60, 61, 62, and 63. It is 4 years of an additional $11,500. It is not 61 plus, but if you have 61, 62, or 63, you get that extra $11,500. You'll find this broken down in your manual on page 60, right? We get an additional for these 4 years. You get an additional $11,250 that you can contribute. Good question. That's a new rule that's been passed. All right. As promised, we would go till about 8:30. We did start a few minutes late for an opportunity for people to get in their links and connected. We appreciate you joining us this evening. We're not going to close it out completely because some people might have some questions. Any questions out there that we need to answer, or thoughts or ideas anybody'd like to add? Richard as well. Would you like to add anything before we close out?
Just the question that I ask everybody all the time is always, if you could look at your situation now, look at your situation in retirement, and you could retire now, would you continue to work? And most people haven't even thought of it because they put their nose to the grindstone, they work, and then now they're 62, their idea, 65 or 67 for retirement age, and nobody's done a net to net. And then when you look at it for yourself and you could see your options and then very, very clearly state, wow, look, I can retire and make more in retirement than I'm working. Why am I working? We only live this life one time. And we're not promised anything other than someday we're not going to be here. So why are we working? So we can put money away to retire and enjoy our lives. So isn't it better to retire sooner because we're more mobile? My mom's 90 years old. Her big deal out is going to the doctor's office or CVS or Whole Foods. You don't travel, but you're going to use your youth and do things that you wouldn't do later in life. So isn't the reason that you work to enjoy your retirement years? So by doing these one-on-ones and looking at the net to net and looking at your personal situation with your spouse, with your family members, whoever you want, and now you see, then it's like, why am I working if I can make more in retirement? And it happens every day. I talk to people and they say, well, I thought I had to work until I'm 65. Well, you thought because you never took the time to realize that everything you've been doing allows you to retire sooner than later, 58, 60, 61, when I thought I had to work another 5 or 6 years.
And a lot of people don't realize how as soon as you're eligible to retire, every year you work, you're making less per hour because of that net to net.
The question is, what would you advise those who started in the government young, have 20 years of service and aren't near their 50 minimum VERA age? To look at your situation the same way, because if you're young and you haven't had 20, depends on what department. Some departments changed the rule for the VERA. They said 20 years of service, but you don't have to be 50. But if you're not 20 with 50, or you're not MRA or don't have the years in, you should still look at it, because then you could look at what your options are and understand what your choices are. Some people love their job, some people don't like their job, but I'm working at the job because I want to finish my career and then retire. But if you could look at your options and maybe And there's so many different ways to go with this conversation. That's why these one-on-ones, and I keep stressing the one-on-ones because it brings to light your situation. And I could talk in generalities, but the one-on-ones really will help you focus on what I should do. And if you're younger, maybe there's certain things you should do regarding long-term care or life insurance, or if you have younger children in school and college education for your kids and mortgage. There's so many different. Wow, it opens up a big can of worms. So that's why I said having a one-on-one will answer your questions and be able to tell you exactly how you should approach the future. And it's great talking to people that are younger, because people that are older say to me all the time, I wish I met you when I was 10 years younger. I would have done this, that, and the other thing. And then people that are younger take advantage of that because nobody was able to help them until they saw it all in front of them, and it made a lot of sense.
Marcia, thank you for your questions. Tamara, thank you for your questions. I know some of this can be a little bit scary and daunting, but one of the things that Richard and I try to do is take the fear out of retirement. That's our goal. Is let's figure out the numbers so that the retirement doesn't look as scary.
Yeah, and what we'll do is, even I help people every single day do the GRB or fill out the paperwork, because we've done it 1,000 times. You've never done it ever. So it's good to have somebody holding your hand, walking through and making sure you're making right decisions. Because when you make a decision with the government, most of the decisions are like, hey, I made eggs in the morning and then I got a phone call, I got to go out. What do I do with my eggs? Well, you can't put them back in the shell and put them back in the refrigerator. With the government, you can't change your mind. So a lot of decisions you make, you want to make sure you make the right decision because you live with it. And then there's 2,700 rules about Social Security. I don't know 2,700 of them, but there are a lot. And there's so many different things to know and understand about Social Security and your options. That's a whole conversation all to itself. Just want you to know all the different options, Medicare and FEHB and Social Security, when to start it, how does it impact you, the life insurance. There's just so many conversations to have. That's why we wanted to have this conversation.
Yeah. We appreciate your questions. We really appreciate Cynthia inviting us and then passing this out to your coalition here. And we want to support and help you in any way we can. We appreciate Cynthia's invite. She was the one that coordinated this and made it all happen. So if you'd like to say a thank you to her as well, we'd appreciate that. Are there any other questions out there before we go ahead and disconnect our session?
I just wanted to say thank you so much for all of your extreme knowledge and experience. And I want to thank Cynthia for inviting you all. I retired in 21. And so, yes, there's a lot of stuff that I'm learning about Social Security. And thanks for sharing everything.
Yeah, and that's an interesting insight. You're already retired. You've been doing this for 3 or 4 years, and you still learned a little bit. Like even going through it yourself, there's new things to learn.
There's always something to learn. But thank you so much for all of you.
You should have also gotten an email from Richard with the manual inside it. He accidentally he mistyped his email. He said RL Brenner. It should be coming from rbrenner@fedseminar.com. So I typed that in there. You should have seen the email. You can reply to that email to set an appointment with him as well, or go to that link in the chat. But just keep in mind that you want to click on that link pretty quickly, or just Fed Seminar and then click on free benefit analysis. You can get that, because once we close this out, you won't be getting it.
Oh, yeah. Oh, by the way, if you go on the Fed Seminar, you're going to get an auto response. You may not get an auto response because sometimes the government.mil will scrub it out. It may go to your spam. If you think that if you filled it out and you didn't get a response from the Fed Seminar, please feel free to just email me directly to the email I sent you all with the Teams link, and feel free to contact me that way or call me, whichever way. Go on fedseminar.com and set it up that way.
Yeah. If you have any coworkers, friends, even though they're not part of the coalition, you're welcome to share our information and that website. We do these reports for federal agencies across the country. So you're welcome to introduce them to that. As a federal contractor, we learn if we do the right thing by you, some of our best advertising is coworkers sharing. And it gets us more contracts in the long term if we take care of the federal employee. So please feel free to share that link or Richard Brenner's contact info with coworkers.
Thank you.
It-
Cynthia, did you have anything you want to add or? She's still there.
She's on mute.
Okay, because I know she.
No, other than just to say thank you to both Richard and Daniel for an awesome presentation tonight. And I am a recipient of them assisting me with my retirement. My retirement papers went in last month. I will be officially retiring January 31st, 2026. And Richard
Hey.
took time out to assist me and my husband in making our final decisions. And it was greatly appreciated.
You're more than welcome, Cynthia. It's my pleasure.
Thank you, everybody. We'll go ahead and close the meeting out in 15 seconds if nobody chimes in. We appreciate all your time, and you all have a great evening. Be safe.
There is no charge for the one-on-ones, by the way.
All right.
People
Thank
think
you
there's a
so
charge.
much.
You're welcome.
Thank you.
Thank you.
Yeah.